when you were seeing on the ventral aspect of the brainstem, there are sulcus, right? Like you have sulcus on the cerebral hemispheres, you even have sulcus on the brainstem, and you even have sulcus on the spinal cord. So in the spinal cord, there was this anterolateral sulcus in the spinal cord, and to that anterolateral sulcus, there were efferent nerve rootlets arising from the anterior horn of the spinal cord, right? So that means from the anterolateral sulcus, the rootlets which emerge out, they are actually efferent nerve fibers, autonomic fibers or the somatic fibers from the spinal cord. So here, this area here you're seeing is pyramid and olive. So in between pyramid and olive, there will be anterolateral sulcus extending down. In anterolateral sulcus will be more prominent in the middle and lower portion of the medulla, and from there, this 12th cranial nerve will arise, because that is pure motor nerve for the muscles of the tongue. Then again, compare with the spinal cord, there was this posterolateral sulcus in the spinal cord, from where the afferent rootlets were reaching in to the dorsal horn of the spinal cord. So posterolateral sulcus is actually the sulcus for attachment of sensory nerve fibers, sensory nerve rootlets. So remember, now this sulcus here between the olives and the inferior cerebellar peduncle, that side, if you continue trace it down, then you will find that the sulcus which is posterolaterally located, and from this sulcus you will find the 3 nerves emerging, and those are 9, 10, and 11th cranial nerves from the medulla. So if you keep comparing with the spinal cord, that's why we're teaching neuroanatomy from down to above, caudal to rostral. So this will emerge here from the posterolateral sulcus of the brainstem above the vagus.